there, I'm Jeff McCalco. We're here at the Digital Health Live Summit studio down on the show floor here at CES. I'm joined by Dr. David Katz. Doctor, tell me a little bit about what you do and how you were involved in the summit today.
Well, thanks, Jeff. Good to have a few minutes with you. So in general, what I do is preventive medicine, particular emphasis on lifestyle. But really what it's all about is empowering people to have the best possible life, adding years to life, life to years. And more that involves technology, empowering people to do things better than they could before with tracking, monitoring. Some of that is to manage chronic disease, some of that is to promote health, some of that is to alert the healthcare system. So I've gotten involved with some entrepreneurs doing really brilliant things in that space, most notably WiseWare. So I was here to speak on a panel this afternoon with my colleagues at WiseWare, Jerry Wilmick, who's the CEO. They have some technological innovations that I think are a real boon to my field of preventive medicine.
So we hear a lot of, well, the market's very crowded in terms of wearables and the data collection. We hear a couple different perspectives.
Right.
A lot of times people are saying that physicians are already overwhelmed with data. They don't want to get any more. So
True.
How do you get around that situation where you're just getting more noise, not really getting anything that can be effective?
That problem is going to go away. Yeah, it's a great question, and it's absolutely true. But the age of the electronic medical record is here, and it's not going away. And a lot of us don't love it, but it's a done deal. So the next great revolution is more user-friendly EMRs, but a seamless interface between technology like WiseWare's wearables, so the data uploads flow into the EMR. We just have a richer medical record. We didn't have to do a thing.
Sure.
So the problem with data is when you have to manage the data. When the data manage themselves, it's not a problem. Then you just have greater clarity, greater accuracy, and a fuller story, which helps you take better care of your patient.
So let's dive in a little bit into the accuracy, because there's been complaints that I'm wearing my watch here. If I just go like this a little bit, it looks like I'm kicked up some steps. So where's the technology going where you as a clinician will be more confident in the accuracy of the data?
So you'll talk to Jerry and get details from the engineering perspective about how problems of accuracy are solved. But that ultimately that is an engineering issue. Quality of sensors, the quality of information relay. If we've got technology that's performing like it should, it's capturing the data we want, capturing it in real time, recording time and place. Once you have that, and that really is just an engineering feature, then the information relay, that's standard, and the interface with the electronic medical record is basically a widget, and it's so much more useful than asking a patient at a 3-month visit, all right, so tell me, how many times over the past 3 months did you feel X, and at what times of day, and what did you do those days? We never get accurate stories. The technology will fill in all of those blanks, and that empowers us not only to use the technology in real time, but to use that pattern of information proactively to take better care of patients over time, and really, enhance health outcomes significantly.
A longer conversation could certainly be had about that, but I'm afraid we're out of time. So if people want to get in touch with you and learn more, what's the best way to do so?
No, they want to find me. My website is davidkatzmd.com, but again, I'm privileged to be here on behalf of WiseWare. Just Google WiseWare, you'll find us.
Okay, very good. Well,
thanks.
Thank you so much for your time.
Thank you, pleasure.
So my name's Jeff McCalco. We're wrapping up here at the Digital Health Summit Live studio down here on the floor at CES. I want to thank Dr. Katz for his time with us, and we'll see you next year.